Mhm.
Good evening and welcome back to the Ask Dr. Renee show here at blackdoctor.org. First, housekeeping. Please let us know where you're watching from. Type it in the chat and let us know where you're watching from. And then also share the broadcast. Sharing is caring, and there's going to be a great wealth of information that I know will be very helpful to, if not you, your sister, your aunt, your godmother, your grandmother, your mother, your whatever, a lady in your life. And so please share the broadcast. And what's the last thing? Oh, if you have any questions, type those in the chat and I will try to get to them as best I can. But we have a really great conversation for you this evening. And I have two amazing guests. One is going to join us a little later, but I'm really excited for you to check this, to hear what we're talking about tonight. So, as we all know, March is a time that when we take a moment to recognize the significant contributions that women make each and every day in every corner of our globe. It's during this time that we also put a charge to our sisters to take control of their health and know their status, whether it's about diabetes, high blood pressure, or HIV. So, across the board, sisters are disproportionately impacted by a variety of health challenges, including HIV. The good news, my sisters, tonight we can change the narrative. So, joining me tonight, I have my friend and sorority sister, Dr. Alftan Dyson, who is a pharmacist who specializes in HIV and HIV medication. So she is going to inform us on something that I know everybody hears about on TV every day, but you probably had no idea what they were talking about. And we just previously had a conversation about even physicians do not know this information. So this might be some information that you need to write down or put in your phone. And when you go to your next doctor's visit, you need to talk to them about and inform them about it. Because unfortunately, we just recently had a meeting with a bunch of physicians, and we've learned that there are a lot of doctors that just don't know about these medications and how to prescribe them. And so I'm so excited for this conversation. Thank you so much for joining us, Alftan.
Yes, thank you for having me. So, Dr. Renee, so as Dr. Renee said, I'm Dr. Alftan Dyson, pharmacist by training and an HIV specialized pharmacist. And I live in Montgomery, Alabama, but I hail from Memphis, Tennessee. That's where I grew up most of my life, spent most of my time, and actually trained in Memphis, Tennessee at the University of Tennessee Health Science Center. That's where I received my PharmD degree, and then really got my specialty training in Kansas City, Missouri, where I did a intensive rotations and residency program out there, and specialized really in HIV at that point, and have been doing the work ever since. So happy to be here.
And I have to ask, what made you go towards HIV?
Yeah, so it's a really good question, and and I always used to share this with students when I was precepting students, that I didn't study the HIV lecture in school. I thought, oh, I won't be working in that field. It's not that much. I don't need to really specialize or think about that, right? It's not something that's super impactful anyway or happening. So I don't need to worry about that. So I was one of those people who didn't realize that this was such an important topic and something that we really needed to focus in on. And it wasn't until I did a rotation, my last year, clinical rotations at a clinic in Memphis, actually, and ran into had a patient that really kind of changed the trajectory for me and changed my direction, changed my life actually, and really was when I decided, this is what I want to do. If I can make this type of impact, I want to do this every single day. It was unfortunately patients who look like me, right? So Black and brown people, Black and brown communities disproportionately impacted by HIV. And I felt like I was hearing the call that I could do something and I could really lean in here and take care of my community, take care of my people, take care of all people, but particularly those who are disproportionately impacted by HIV, which happens to be Black and brown communities.
So, as we all know, when HIV came on the scene, if you want to say, it was supposed to be the gay man's disease. Well, we all know we don't all know. Some of us know. Actually, our guest is coming right now. Well, we'll give her a minute. But we don't all know, but you can help us to understand in 2025, that is very vastly, that's not even the population that's really growing the HIV numbers, unfortunately. So can you talk a little bit about that?
Yeah, absolutely. So what we do know is that roughly each year, give or take a little bit, there are about 38,000 new HIV diagnoses in the United States, right? So not globally, just here in the United States. If we talk globally, it's much higher than that, can be in, over 1 million. And so really, that's one piece is, and people think, as you said, oh, the 38,000, that's not me. That's not my community, or that's not me, right? And what we do know is that 21%, actually around 21% of those new diagnoses are in women. And then when you break that down even further or dig in a little bit deeper there, of that 21%, more than 50% of those women are Black women. And so this is something that I don't think many people understand. The other piece is when we think about not just the new diagnoses, but prevalence and the people who are living with HIV, of the women who are living with HIV in the United States, 57%, so more than half of those women are Black women. And so this is something that is impacting our community. It is impacting women, and particularly Black women. And also, if we think about Latina women as well, this is something that is disproportionately impacting communities of color, and particularly for women as well. And we're seeing those rates increase, and we're seeing that particularly in areas where we concentrate, right? Where we congregate, and in southern states, but also in large urban areas. And so it is something that, is a kind of a bit of a misinformation, a misnomer that, oh, it doesn't impact women, or it doesn't impact, Black women. It absolutely does, and actually disproportionately impacts us.
Yes. And so the other thing is, I don't think people quite realize the ages.
Yeah.
The ages, unfortunately, are even younger than you probably think, unfortunately. And I think that that's why it's so important that you share this broadcast, because mom and dad, one, I know because I've done campaigns for it. Sex education is not in most schools anymore, which is just very unfortunate. But if it's not in the schools, and if mom and dad are too skittish to talk about it, where are they going to get this information? And this is such important information, and it's affecting children. I mean, high schoolers even. And so, and I was just telling Alftan, I had a conversation with someone who was diagnosed at 17.
Yeah. And so we do see that, right? And so when you talk about age, it's typically the majority of folks, new diagnoses are occurring in folks who are under the age of 35, right? And as young as, we see numbers sometimes as young as teenagers, as you're mentioning. And so it's really important that we, as you said, have this conversation with our youth and with our young people as well about one, getting tested, right? Knowing your status is important, but also talking about ways that we can prevent HIV and other STIs for that matter, right? We really need to do a better job of having this conversation, and having the conversation in places, in spaces where we feel comfortable, right? Bringing this right to the doorstep of where folks are, and having that conversation in a place that feels safe for them, showing up, meeting people where they are.
Well, I know for a fact, especially we learned in COVID, that we tend to trust the pastors and we trust the Black church. And so even though people are like, oh God, you can't talk about sex in church, I'm sorry, but we all got here some kind of way, you guys.
Absolutely. And then the other piece is how did sex even happen? Who created that, right?
Thank you.
From God. So why can't we? Why is this not the right place? Church is the right place.
Church is the right place to have the conversation. And also, I think that, yes, we love, and you encourage married folks. Married folks should have sex, but we all know that unfortunately, married people have a past. And
Mhm.
so that past may involve that they might already have HIV before they get married. Maybe they are completely faithful, but they might already have had HIV. But if we don't know our status,
Right. We wouldn't know. We
we'll
would.
have no idea.
Right, right.
No
I had
idea.
a conversation with some high school students, probably back earlier in the year and about January. And, my favorite, to your point, the favorite question that they asked me that day was, well, how would somebody know that someone's living with HIV? And my colleague and I were there standing next to each other together and in unison said, taking the test, because there's also that perception, oh, I can look at somebody and tell. Like, I'll be able to know. And you won't. You won't. And so the only way, surefire way to know someone's status and know your status is the test. Get the test. Get the HIV test
And
at your
it's not, it doesn't even involve blood anymore either. But we have our guest. Let me get her on here.
absolutely.
Good evening, Reverend Glencie. Unmute yourself. Uh-oh.
Uh-oh, Reverend Glencie, can you hear us?
Can you hear us? Uh-oh. Okay, well, we'll give her a chance to try and figure that out. But yeah, so that you can't tell. And I've worked with teens as well, and there's a young man that did a lot of advocacy work for HIV, and he was, as the women and the girls, he was fine. Okay, fine as wine in the summertime.
Yes.
And I knew him, so I knew he was HIV positive, but I didn't, of course, tell the kids. And when I tell you the girls were drooling, like this man was so fine. So then he's talking to them and he just was going. And when he told them, I mean, a hush fell over Jerusalem.
Yeah, exactly. It's like, oh wow, really? But I think it was probably a good learning experience for them too, right? To see that, it isn't something that you can just look at someone and be able to tell their status. And really, the only way to 100% know someone's status is to actually get the test and
Exactly.
get the test results, right?
Yeah. So Reverend Glencie has joined our conversation. She is bringing the faith aspect to our conversation, and we're so happy to have you and doing this work with us with HIV Task Force Network and getting the word out, because we got to keep getting the word out because we still have a problem. It's still a pandemic. It's still an epidemic, unfortunately, and it really shouldn't be, but it still is. So we have to get the word out. So Reverend Glencie, you came in just in time. We were talking about faith leaders and how we can get the word out. So, what are tips that you would offer Alftan to someone like Reverend Glencie on how to engage in more conversation about sexual health, especially among Black women?
Well,
Yeah.
one of
Oh,
the things that we are doing in our community, I know that education, folks don't like to hear you say education, but when they tell you that education is fundamental, it is truly fundamental. And so with our faith groups, that's what we're doing. I am currently working with two churches here in Charlotte, North Carolina that get it, that understand it, that are not afraid of languaging to be used, not afraid of understanding uh, people love whom they love. And
Mm-hmm.
so when you can find a faith um, congregation that is open enough to embrace and be inclusive, that's one great thing. The second great thing is having the ability to have intellectual, emotional, age appropriate dialogue, right? So that we can learn these terms. Even though I'm doing this work, I'm still learning the best words to say, right? So I'm not embarrassing anyone. And so I think that one of the things that we even talk about is it's not even about so much about the education, it's how we educate. The church is still locked in, we don't talk about sex. Well, that's our problem. That's our biggest problem. Because if we were able to have the conversation about human sexuality,
mhm.
then we would not have the rise in teen pregnancy. We would not have the rise of what happens with unprotected sex. we would not have the rise in numbers of HIV and syphilis and all the other STDs that we encounter because we were not afraid to engage in the conversation. We focus on so much of, well, if we talk about it, they're going to go out and doing it. Well, I mean, you haven't gotten the message yet. When you don't talk about it, they're doing it. So if you
Or they
provide
get the information from the wrong place and it's
right,
not the right
so
information.
if you provide the information in the faith space, then they would come. Hopefully, my thought process is that they would walk away with an educated thought process about doing it, right? So we got one of the things that we have to do is to be afraid of what's going to happen anyway.
Hmm.
We have to also understand that uh, I don't know if I can say it in this space, so I won't. But
You can say
I,
whatever you like.
I'm going to say I'm going to phrase it like this: if we can understand that God created this whole
Mhm.
body, and
Hmm.
that God provided us with all of the emotions, all of the desires to go along with this body. If we understood that and did not separate it and then name it to be something evil and bad,
Mhm.
then you would be able to have that conversation in your church, in your Bible studies, in your small groups. Instead, we shun it, we demonize it,
Hmm.
and we shame it. And so then what are you doing? You're doing everything in the dark. And then when it comes to light, you act like you didn't know what was going on.
Right.
And so we, especially in the Black church, I can't speak for any other churches other than the Black church, for a very long time, and even in this 21st century context, we still, the mention of word sex is almost, excommunication,
Yep.
the
Mhm.
quickest, right, to get you out of the church. But if we understood that you're not talking about engaging in sex, but you're talking about what the human body is designed for,
Mhm.
and that while we want you to wait for marriage, which I think that's a whole colonized thing too, um, if you are going to engage and that's the direction that you want them to go, then prepare that should that not happen. These are the things that we don't want to happen to you along the way, right? We don't want you to become diagnosed with a virus that's going to be with you for your whole life, right? We don't want you to have a child having a child. So if we educate, if we are not afraid to provide prophylactics, if we're not even afraid to talk about it,
Mhm.
right, then we as the church would not suffer the separation of our community from the church. We would begin to embrace and show the love. So, can you imagine when you have two churches that are willing to be outgoing and to engage in those conversations, that you still have churches that are talking about those churches?
Mhm.
So, we have a long, 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 long way to go.
So are
Mhm.
you seeing more faith leaders engaging in real talk about sex, sexuality, HIV, Alftan, and Reverend Glencie?
Can I make a face?
My face says it all. I think that
It's the hope. There's some.
oh, there are some, right? And so I mentioned before, I'm in Montgomery, Alabama, and in Montgomery, we do have a church here that does have a wonderful program. She looks like me, and they designed the program to really speak about, HIV prevention, to talk about, getting tested, understanding your status, not just with HIV, but all STIs, and really having that conversation. And they're out regularly beating the pavement, setting up tables. They do testing. There's two nurses who are members of the church who really started and kind of spearheaded this program and got this going, and are testing at events throughout the city, and even beyond. And they do things around with the youth. We talked about youth earlier. So usually in February around Love Day, right? Everybody's like, fill in the love, and fill in whatever else they're feeling. They make sure that they do a skate party, right? And they show up there and they have pass out information, and they do testing at the skate party, right? And pull the youth in to have this conversation. And
So
so
one
there
of
are places
Yeah,
that do.
one of the churches that I'm currently working with here in Mecklenburg County, they are preparing because April is Youth
Yep,
Sexuality Month, I think, or
yep.
something like that.
Mhm.
So they are preparing. We had a conversation on breaking down the age ranges, having that conversation, making sure that the adults are in another space so that the young people can feel brave to have that conversation. And so they have engaged in creative ways to have people come together. So I think that they are doing we talk about like the paint and sip.
Yep.
So they're not doing a paint and sip, but they're doing a dance and praise or something like that.
Yeah.
But they're using the paint and sip concept to have the conversation. So we were talking about how would that look? And so have the education piece and then have the question and answer piece around the paint and sip or the fun or however they are doing it. So I'm looking forward to just how that's going to pan out. But starting on at that age range, having that conversation with our young people. But as I was listening, if I can back us up a little bit, we have that older group, our seniors that are so free,
Yes. Yes.
right? I mean, free, and hey, I don't have
In
no
the
problems
nursing
with being
homes.
free
And,
in their assistant livings and in their communities, and they are, can I say, rocking it, but they're rocking it without information,
right.
right? And so that's another group that's growing within the Black and Brown community, is that our women 55 and older who already, we're not having any more kids, so
They're not
you
worried
don't
about
have
it.
anything to
They
worry
don't have
about,
to worry about
but
it.
yeah, you do. So
Oh,
being able to draw them into having that conversation, because keep in mind they grew they were in the church growing up with, you don't talk about that.
Mm-hmm. Mm-hmm.
So being able to circle back around on both sides, perhaps having an intergenerational conversation around human sexuality would be a powerful thing, because not only will it be an educational opportunity for seasoned women, but for our youth to understand that it ain't going away when you become our age, right? It's not going away. So
Mm-hmm.
if on both sides of that, we're going to engage, let's engage in healthy, safe activities so that life continues on for the senior, and life that's beginning for our youth gets to be senior
Right.
yeah.
because of conversation and have it on an intergenerational scale.
And so we keep talking about testing. You guys, literally, it is swabbing in your mouth. It is takes 2 seconds. Like I said, you don't even have to worry about blood and needles. 2 seconds, and we will eventually put the website up to get free tests, because you can have tests mailed right to you. The box
Mhm.
won't even say that's what it is, so you don't have to feel outed or whatever. But you will have what you need, and you can have the results literally in a matter of minutes in the privacy of your own home.
Mhm.
So
Mhm.
it's very important that you do know your status. But I want Alftan to talk about PrEP. Now, I don't know if anybody else watches television, but there are commercials about PrEP 24/7. But the
Yeah.
way these commercials are done, and they're working on it, because I know they're working on it, but
Mhm.
they're not the easiest to understand what they're talking about and what they're alluding to. So can you
Mhm.
explain to us? Because I saw a new drug the other day and was like, wait a minute.
Yeah, so it's a good question. So I'll start with one thing that I don't know if a lot of people know. We've had PrEP, or HIV pre-exposure prophylaxis, for over a decade. The first
Mhm.
PrEP option came to the market in 2012,
Wow.
right? So that's a long time to have something available, and for us to still be having this conversation about the disparities that we see, right? And another thing, just to share about PrEP, because you said we're seeing the commercials, but what we know is that there's still about 20 to 30% of women, Black women, and women in general, but obviously thinking about Black women, that don't know what PrEP is. Like only about 20 to 30% do know what PrEP is, right? And so then when we look at how many women are on PrEP, it's about 8%, right? Way more opportunity there. So what is PrEP, right? It's pre-exposure prophylaxis. That's what PrEP stands for. And it's a medication to prevent HIV. And so I know I tell that to people and it blows their mind. They're like, you mean to tell me that there is a medication or medications that I can take that would prevent HIV? And the answer resoundingly is yes, absolutely. There's medications and there are different options. There's different forms, right? You have some people prefer oral options and prefer pills. Some people prefer injectable options that are more long-term, long-acting. We have both available on the market for women, and so that is what it is. And so I think about that, and we're having real girl conversation, real talk here. I would say, when you think about it, what is this? What are you liking it to? We've had this with birth control before, right?
Mhm.
You've got pill options, you've got long acting options, and you choose what works best for you. And so it's really about finding out about those options, knowing that they're available, and then being able to go in, have a conversation with your provider about which options meet your needs. And in terms of, people say, is it effective? Absolutely. The studies we've seen are anywhere between 95 and 99% effective at preventing HIV. Of course, nothing's always 100%, right? But
Right.
we've seen great efficacy with the medications that are available, with that, again, that range of 95 to 99% efficacy for those prevention options. So yeah, that's
So they're doing research. There's new, like I said, I just saw a commercial for a new one. So not necessarily do you have to take medication every day. Some of
Mhm.
them you take a shot once a month. Some of them it's a couple times a year. So you just have to figure out what works best for you. But honestly, I learned last year when I had a conversation with several women that were HIV positive that was here on Black Doctor as well. And you can find that conversation over on my YouTube channel, Ask Dr. Renee. But in that conversation, I learned we are all HIV possible. I'm possible because we are all, every one of us is possible walking around. So we're not necessarily positive or negative, but we are all possible. So then you need to find out your status, and then you'll know, where to go from there. But PrEP is a great option. And actually, newsflash, just this week, did you see it? Tamar Braxton,
yes.
she was on PrEP.
Yes, and she used that tag. She used the same line you said, that she was HIV possible, that she's recently separated, she's recently single, and that she knew that she was gonna, be outside doing life, doing her thing. And she said, "I'm HIV possible, so I'm going to get on PrEP." And so she is on PrEP. And so I think that's, we're seeing that. I want to key into something you said too around the HIV possible, because I want us to also understand really what that means and like break that down. That the CDC, right? Like, who we get a lot of our health information from, they have guidelines on who should providers have a conversation with about PrEP. And the key that they put up there, the one thing that is common, it says anyone who is sexually active.
Active. Mm-hmm.
That's it. So I say that because a lot of times we get in our mind, oh, well, I don't need that because I'm not like that. I'm not promiscuous. I'm not out here. I don't have all the same people. That's not my, it's not even about that. They say if you are sexually active, we should have a conversation about if PrEP is right for you. Right? And
But you realize that all of that goes right back to not having that healthy conversation about human sexuality, right? So going back to your HIV possible says that you understand if you're sexually active, it's a possibility, but you got to have the conversation.
Right.
So in our heads, we develop, we don't do that.
Right.
And so with that, all of the ignorance follows. So yeah.
But yeah, you have to have a conversation, obviously, with your physician. You can't just go get PrEP on the corner. You have to,
Right.
it's a prescription. So you need to talk to your doctor to make certain that there's no reason that, you should not be using it. And have the conversation with your doctor. Your doctor can say, hey, this is something that, you're right. This would be a good idea for you, or this is why it's not a good idea for you.
Right.
But you need to have the conversation. If you don't ever have the conversation, you'll never know. And here's a way that you could have completely been keeping yourself safe. Everything is to keep us safe. So,
Right.
yes, condoms are 99%, but we all know, unfortunately, some people don't wear them when they should. And then there's the female condom. Well, then a lot of people don't know where to get the female condom because it's not as widely known as the male condoms. And so, there's all these things, but PrEP is something it can be in your system. And if you get exposed, it is going to protect you. So it is really important you have the conversation with your physician to find out, is this the right option for me?
I
And
want
if it
to
is,
ask a question of Dr. Dyson, because I know that in getting my physical, okay, that question, I think that there should be a way that that question is a part of all of the questions that are asked to help prompt the person, because I get, are you sexually active? No, I'm not. But I don't get the other questions that go along with that. I did get the question, do you want to take an HIV test? I'm like, well, I'm doing this work, so I can't really say no, or I shouldn't say no. So I'm like, yeah, do the test. And so I think that even our doctors need to be more comfortable in asking the questions, because that way it may bring to consciousness uh, the patient that's in front of you to ask for more information, right? So, because you got the little checklist, so just put that question on there, I think would
yeah,
be very helpful.
Absolutely. And I think, two of the things that you said there around the questions, I would challenge you to challenge your provider the next time the way they ask you the
The
question.
next time I will.
The acting, well, that doesn't give us room to have a conversation. That's a yes, no. Where's the
Mm-hmm.
open-ended question? Like, tell me a little bit about your sex life. You
Mm-hmm.
find out a whole lot of information if you ask me to tell you about my sex life, right?
Mm-hmm.
Having the type of sex that you would like to have, is it pleasurable for you, right? And I bring the pleasure one in because a lot of times people get kind of shy away from that when they get squeamish about it. But imagine if sex wasn't pleasurable because someone's in a situation where they're in an intimate partner violence situation.
Right.
That may not be pleasurable. And so now you've uncovered something else. You've been able to have a conversation about something else and help in another way. Or as we were talking earlier about, us changing and getting older and aging and going through different seasons of our life. As women go through age and go through menopause, vaginal dryness is a real thing. And so it may not be pleasurable because there could be pain there. And we need to have a conversation about that. And actually, that's a very important place to start having that conversation, because with the dryness, you have the propensity or the possibility of vaginal tearing, right? And so now you're even more vulnerable to STIs and including HIV. So it's important to have these conversations. And I would say, don't wait for your provider to ask you either, right? We're giving you this information. We're making sure that you have the tools that you need and are equipped with the information to go in and ask your provider. If they don't ask you about an HIV test, then you ask them, hey,
Mm-hmm.
you have HIV testing available. Can I get an HIV test? And, be prepared to even share with them why you want an HIV test, because I just want to know my status, because it's important for me to know my status, right? And thinking about places where there's a high prevalence of HIV. We know in the South, right? There's a much higher rates and higher prevalence. And so that just alone in itself, because the numbers are greater here, that puts you at more vulnerability for HIV. So it's really about being able to have that conversation, go in, feel empowered and equipped to go in and have a conversation with your provider. And for the provider to then, I think that will also make it easier for the provider too. It might make them a little more comfortable.
right.
Because too, they might be a little uncomfortable asking you that question. They may be like,
Yeah.
I don't want to offend my patient. And so if this is a two-way dialogue and we're both in a space where we can have this conversation freely, man, just imagine what we can get out of that and how we can actually be in a space where we can really make change and prevent any type of unwanted infections that we really don't want, and we don't want to see that. So absolutely.
Everyone should be going to the doctor annually anyway. So when you go, you get tested for everything. So why don't you just say, "Can I please have an HIV test?"
Yep.
Yeah.
Yep. And don't assume. That's another thing, because you said we should get tested for everything.
Yeah.
Sometimes the providers say, "Oh, I'm going to test you for everything," or "I'm going to do everything today." Make sure of
Right.
what
That's on the list.
What the everything is, right?
tell me what everything is, because
Mm-hmm.
I can't tell you how many times they say, "I'm going to do an STI panel," but they don't include HIV,
Nope.
Mm-hmm.
right? And so you need to ask the question when they say, "Oh, I'm doing everything." What is everything? Can you tell me? Can you go over it with, like, what are we getting today?
Right.
Yeah. And you want to make sure that you and then any partners, women, you need to see in writing, or you all need to go together for the testing.
Yeah. Yeah.
I prefer you go together for the testing because anybody can
That
type stuff up
there's
these
no,
days.
there's
You
no,
know,
yeah, I got it, and no, you
exactly.
didn't.
Yeah. So you go, unfortunately, there's some people out here that are, not so on the up and up. And so you want to make certain that, you guys go together, you do it, and you know that they did test and the results are the actual results that came through. So it's very important though you have the conversation. If your doctor doesn't mention it, make sure that you mention it. And if it's not the OBGYN ladies, then go to then your PCP.
Mm-hmm.
But make sure you have the conversation. Once you find out, okay, you know your status, well, then maybe you do have the conversation about PrEP and see if they, if they recommend that this would be something for you, or if they say no, then why is it not for you? But make sure you have the conversation. If you never have the conversation, then you have no idea. So you really, really, really need to start the conversation and make sure you know your status. Just like we know if we have diabetes or not, just like we know if we have high cholesterol or not, and all of those things.
You know your numbers.
You need to know this isn't this isn't a number, but it's one of the other
Yeah,
things
but
that you need to know along with your numbers. You need to
yeah.
know your status. You need to know for you, but you also need to know for anyone else in your life. And actually, pregnant women, they automatically, I know for most OBGYNs, get tested for HIV. Mm-hmm. So as soon as they find out they're pregnant, that's one of the first tests that is done. But for people that are going to the OBGYN just for your annual exam, for your pap smear or whatever, just like they gonna check your breasts, you need to just say, excuse me, could you, give me an HIV test?
Mm-hmm. Yeah.
And don't think anything about it. Like I said, we're all HIV possible. So don't think anything about it. Don't think the doctor's gonna think something about you. Just say, excuse me, I think that I just would like to have, just so I know. So then you have the information, because it's better to have the information than to not have the information. Knowing is half the battle. And yes, we have come a long way with HIV and AIDS, but we still have a ways to go, but we have come a long way, and people are living much longer lives and healthy lives, great lives. But why put yourself through that if you don't have to?
Yeah. I think the language, providing us with language, HIV possible.
Yes.
That's new language that can be used, that can start a conversation, even with what is HIV possible, to open up that door. So I think that's having language that helps engage in conversation is very important. So now I have new language to add to my lexicon.
Yes, absolutely.
And then also, I would be remiss if I didn't say, so what would you feel, you both can chime in, what do you think are barriers for why women do not go get tested and women do not ask about, these prophylactic medications?
Yeah, I'd probably jump in and say stigma is a really big one, right? Especially in our community, because there's just this negative feeling or thought process around, HIV, STIs, but even sex, right? Like that's what we were talking about a little bit earlier. There's just this negative halo over it, and it's not something that should be negative, right? We're all sexual beings, right? And I say to people, we've either had sex, plan to have sex, or have thought about having sex. I think I covered everybody.
I think
right?
so.
And
I think
so,
you did.
and so it's like, why is there this negative halo or this feeling that, oh, it should be quiet and kept quiet? So I think and part of that, the reason is we've done that, and then we've created this situation, this space of stigma, and really stigmatizing sex, but stigmatizing even HIV. And it shouldn't be. We should be able to have sexual health conversations, because sexual health is health, right? If you aren't feeling well sexually, chances are other things don't feel well. This is a part of general health and wellness, and we need to look at it that way and stop stigmatizing it.
And I think the other word is fear. Just the whole idea of, if I get tested, I might have, and then if I might have, then what? So, along with the stigma, then you have the fear. And I think the other word is shame. And the church is a great contributor to shaming and creating the stigma. So, if we could take those three words out, then and again, education is fundamental. Being able to start at the with the basis of having conversations around healthy sexuality, then that in that conversation, just as I learned new language tonight, then you're able to learn new languaging, right? Then it helps to reduce the stigma, it helps to reduce the shame, and it eliminates, I'm going to say eliminates the fear, because now you have new language, you have knowledge that you didn't have before, and you have a community. So we might as well throw that word trust in. So when you put all of those words out there, every last one of those words by themselves can be barriers as to why women, and in our community in particular, will not explore what if, what
Mhm.
can be, and what will be. So, your show tonight, the work that I'm doing, the work that Dr. Dyson is doing, is critical. And I think just being able to have conversations, because the conversations that we're having tonight crosses all lines of what's my words, economics,
Yes.
education, all
Mhm.
of that, because we go back to, oh, we can't talk about that. We
Mhm.
can't have that conversation in a public space. Because you already have the fear that you're going to be labeled just because you had the conversation. So being able to remove those barriers that we just mentioned, every last one of those, will possibly open the door for greater conversation. And so for those who may be watching the show and will see the show later, it is our hope that you will begin to engage with your other sisters and say, look, we just saw the show with these three great women having an open dialogue,
Yes.
letting us know, giving us the permission, if you will, and the
Mhm.
courage
Mhm.
to have the conversation, and then being able to find other women in their community that are in these kinds of roles, that they feel that they will have a sense of trust, that they
Mhm.
can come and engage and have that conversation.
Yeah.
Yeah,
Yeah.
and it's so crazy when I was volunteering at a community center in Chicago, and we used to do events, and we would do events with kids, and they would have the AHF would have a van there, and they would do testing.
Mhm.
And do you know how many kids would come up positive?
Mhm.
Blew me away. And
Mhm.
mind you, a lot of these programs were at churches.
Mhm.
And so, the pastor is just like, beside himself, like he couldn't believe it. But we were like, and this is why these conversations are so extremely important,
Mhm.
because these kids have no idea what they're doing.
Right.
Right.
And they get misinformation, right? The information is wrong. And it's like teaching each other. They're teaching each other, and none of them have the right
The
information.
blind leading the blind.
I'm
Yeah.
leading the blind, and it's like, no, we should be the teachers, right? As elders, as folks who know the information, who can share the information. We should be disseminating that and sharing that information. It goes back to
From a
remember
positive,
positive.
positive, and not from a shaming.
Correct.
No,
You
not at all.
want to
Exactly.
give the lesson after. We're saying being proactive and give the lessons, the education in a positive framework, so it'll be received. Because if you're going to shame me, I'm not going to hear you anyway.
Do that. And then also recognizing that we have to equip new messengers, right? Because
Yes.
how you receive a message also depends on who's giving the message, right?
Yep.
Ex-
The messenger is
that
just
part.
as important as the message. And so perhaps maybe I'm not going to reach the young lady over here, but maybe if I teach or share the information with one of her friends or somebody else that she's close to or that she really trusts, then she can pass that information on. And so I think I love something that was said earlier, that everybody who's watching tonight and everybody who will watch, go and tell at least three other people, right? If
Mm.
you leave this and take the information that you got here, right? In this positive space, we're having a just sister girl, homegirl conversation here talking about what needs to be talked about. And now you go and do the same thing. Imagine how powerful that is and how many people we could reach if we were to continue to disseminate the information as trusted messengers, right?
Right.
I'm a trusted messenger to a lot of my friends, right? And so that's important. So I take even the fact that, I'm a healthcare provider out of it. They just trust me because we have that relationship. And so that's so important to also understand that the messenger is just as important as the message that we give.
Right. And I think that, girls talk about everything.
Mm-hmm.
I don't know why we can't discuss this.
Right.
And for us to have, you missed it, Reverend Glencie. She said 57% of Black women, of the 57% of the cases are Black women living with HIV today. That is crazy.
Mm-hmm.
It is.
Because we not that large of the population.
Right. We only make up 13%.
So that's
and
pretty bad.
I did hear her say, so I said, well, let me just check to see what the numbers are in Mecklenburg County. It's 31%.
Mm-hmm.
Yeah. So see,
Yeah.
so that's what I'm saying. We need to have these conversations. Just be open and talk about it. Let's all together go and get tested.
Absolutely. Absolutely. And how cool would it be? Because we have someone in your area, actually in North Carolina, who created a toolkit for hairstylists to be
Mm-hmm.
have this
Oh,
conversation
that's awesome.
in the hair salon, right? And equipping the hairstylist with being the messenger, right? So it goes back again to that messenger piece. Anybody can be a messenger as long as we have the right information
Right.
and
Information. Exactly.
and so you think about it, we talk about everything in the hair salon, right? We
Yeah.
go to the nail salon and they're like, "Oh, girl, what's new in your life?" Well, I met this new man. And how about if she said, after you said, "I met this new man," she said, "Do you know his status?" See how quickly you slid that into the conversation?
Mm-hmm. Mm-hmm.
Because we already talking about it. We're talking about the man and how fine he is. You were talking earlier about people seeing a man like, "Oh, he's so fine." And that's wonderful and that's beautiful. And I'm excited for you and I'm happy for you and all that is going to come with that. But can we make sure that we protect ourselves and have a conversation with him about his status and make sure that we know our own?
Yeah.
Yeah. I've done several of these shows, and I've done several shows that actually had HIV positive women with me on the show. And a couple years back, we had a lady, she was married and her husband just never told her, but he knew. He never told her. So, I mean, there's so many ways that this could happen to anyone. She would have never thought it had been her, but there was another lady who her husband was sleeping with a man, his best friend, and that's how he had contracted it. And he didn't tell her either. They ended up divorcing, but this woman literally is a saint walking on this earth because she took him in and took care of him until he died. And I was like, there's no way in high heavens. Even her children or his children said, "Mom, you're crazy." But the conversations have to be had. And you have to, that's why we said it's so important that everyone get tested and you know their status because you all went testing together or you saw the test something, because you can't take everyone at their word and you can't trust that everyone's going to tell you everything. And so when she found out, she was in a state of shock. She was donating blood or something, and that's how she found out. And she was like, "Oh my God, what am I going to tell my husband?" Because it never occurred to her. And when she told him, she could see in his face. She knew he wasn't shocked. And that's when she was like, "Wait a minute."
Wow.
So that's why we have to have these conversations. And you are the girlfriend that they come into to talk to, then encourage them to please, like you said, do you know his status? Before you get too excited, do you know his status?
That's right.
Yeah. And I think some of that even too, like the not being able to tell, even your partner things like that, it goes back to the shame, right? And the fear, right? And so, yes, we would want people to be able to have that conversation and share that information with us. But sometimes it hasn't been a safe space. We've not created that safe space. And that's, I think, a key that we're talking about today is creating that safe space on both sides of the coin, right? Like particularly for women, but being safe to be able to have that conversation with your partner, right? And be feeling like we can, because that's important too. And I think it goes back to us, as you were talking before, in the church, being able to have conversations around sexual wellness, right? And the fact that we are sexual beings, but also understanding how to have good relationships, right? What does a good, positive relationship look like, right? Because in those cases, if the relationship is good and it's positive, you should be able to have that open conversation and that type of dialogue back and forth to know each other's status and not feel afraid to talk about that. So I think there's so much that we can unpack around that we've talked about before, that this really is something we need to normalize the conversation so that people feel comfortable, one, asking, but people also feel comfortable sharing so that
Mhm.
we're all informed, right? And we can make an informed decision about
Right.
how we move forward in our relationships.
And like you said, going back to the churches, that's why it's really important that, especially the pastor, in case that's who they come to, or
Mhm.
whoever is in charge of the youth ministry, the singles ministry, or whatever it is, make sure that they have the right information, because that's the other thing. There's so many ways you can contract HIV. It's not just through sex. And so
Mhm.
you don't know if this person had surgery 20 years ago and somehow they forgot to test the blood or something, and that's how they got it, Arthur Ashe.
Exactly.
So you don't know. So you thinking, oh God, what are they going to think of me? You never, if you know good, that you didn't, that's on you, how you got it. Then you can't think that, oh, well, what are they going to think? You just need to go talk to them, have a conversation. And also, it doesn't have to be the end of everything, because, then, people, that's why people don't want to know. And that's not even just HIV. People don't want to know if they have diabetes. They don't want to know if they have cancer. They don't want to know if they have anything. Although early detection will save your life in most everything.
Mm-hmm,
Yeah.
If you figure it out early, there's so many drugs on the market and so many different protocols and treatments and ways that they can save. So if you have to find out, though. So
Yeah.
absolutely.
as what was that, GI Joe, knowing is half the battle. You
Right.
Mhm.
you have to know. If you don't know, what are you
We,
going to do?
we've said
Yeah.
knowledge is power.
And I think that's a part of I think that's a part of our culture.
Yes.
Um, the not knowing,
Mm-hmm.
right?
Yeah.
And then the normalizing of if I'm going to die of something, well, how about if we think about living
Living. Yeah.
and living your best life,
Right.
that instead of I'm going to die of something, let's talk about how you can live and live your best life by being informed early if
Mm-hmm.
there is anything to be
Right.
informed about, and then know all of the different ways that you can that are available to help you have a sustainable and joyful life going forward. So
Yeah.
I think a lot of what we encounter at the end of the day, we may not even see it unless you're working it and doing the research, really stems back to how we came here in the first place, how we were brought here. I don't even like to say
Mm-hmm.
we came because came suggests that I voluntarily decided to
Voluntarily.
come here. So how I was brung here,
Right.
um, in all of the ways that we were stripped of our humanity, and our personhood and our personalness.
Yes.
So, when you think about all of that, and then we find ourselves in faith institutions that talk about freedom, but continuously follow the process of suppressing you, then you feel like you're in a win-lose situation or a no-win situation, right? And so, having the opportunity to have ask Dr. Renee needs to be more available so that again the conversations become normalized so that you can hear the language,
Yeah.
and be willing to take the risk. But someone may not have you come back. I remember when I was preparing to go to Ghana, one of the things that I wanted to do was to meet pastors in Ghana so that I could do some HIV educating. And so when I got, as I was preparing, there was a minister that was really excited and said, okay. And the closer I got to my travel to Ghana, he sent me a message and said, oh, yeah, we really want you to come. We really want you to talk about, but can you talk about something else? And I was like, but I'm not coming to talk about anything else but that. Right. And so he was disappointed, but I was like, no, if you made it clear that I'm not going to be able to come to talk to the women about HIV and what's available and how they can be tested, then this would be a waste of my time,
Mm-hmm.
right? And I would probably, because I'm an advocate, I'm gonna protest. So I'll probably be somewhere in Ghana right now, unknown, because I would insist upon having the conversation. So, but I did have the wonderful opportunity to establish a group in Ghana where we were talking about it. And so what I learned is that the shame is very high.
Mm-hmm.
The excommunication is off the chain, and the fear, once hearing the diagnosis, the fear is off the chart. So you would have a mother with a child, and the mother learns. Then you can't. It's hard to get communication. Then the other thing that I learned was that while we have access to free treatment, they do not. So we're looking at different ways that we can make a positive difference. While I'm here on the U.S. side, that's another story, and working with the community in Ghana. So it is very much a conversation that we need to continue to have, and so I'm very appreciative of you having this sister girl talk.
Yeah. Oh no, definitely. Because like I said, this is something that we could have eliminated by now. It should be gone.
We have the
Yeah,
tools. We have the tools to end
we
the HIV epidemic. We have to use them. And so that leaves me with two final points on some things that have been said. Is the first one is around, in African countries, what we do see is, right, yes, there are sometimes challenges with getting access to the medications, both on the treatment and the prevention side. And what's interesting though is that it blows a lot of the women's minds over there that we don't readily in the US go after these things. They're like,
Mhm.
oh my gosh, bring me the HIV prevention. Bring it to me. Give it to me. I will take it. And we're over here like,
No.
you want to get the test? Like, no. And it blows their minds. I've had so many conversations with women, and they're just like, I don't understand. Like, bring me over there so I can sit down and talk to them and tell them, like, do you know what a gift you have? Like, it is
Mhm.
available to you and you can get it. And we just want it. We want to have it, and we can't get it in some instances. And so
Right.
that's one. And I think the other is like, I would be remiss if I didn't talk about, folks being on treatment, right? And so we talked about get the test. People are fearful of, oh my gosh, what if I get positive result? What do I do? We've mentioned, I think, several times throughout here, Dr. Renee, you mentioned it, that the medications are great, even medications for treatment, right? And we can get on therapy, get on treatment, and get to what we call undetectable, right? Where our virus is undetectable. And if someone is undetectable, U equals U. Undetectable equals untransmittable. And so if they're on therapy, on medication, undetectable, they cannot transmit HIV to their sexual partners. Like, full stop. U equals U. And so that's so important to know that also, because getting the test means we can do two things. If it's positive, we have a way that we can go. We have medication, we have treatments that we can have, and make sure that we get to undetectable. But if it's negative, we also have medication. We also have options for prevention. And so there's something that you can do. The key is getting that test and not being fearful of what comes out of it, and knowing that you can actually you'll go in two different directions, but you still have medications available to you, and there are resources and there are things that can be done. And so once we know that, then we can do something. Once we know better, we can do better,
We
right?
can do.
Exactly. And I've had Ray Lewis Thornton, which many of you know, on the show several times. She has lived with AIDS now probably longer than she's lived her life, even. Like, she's been positive more than she was, ever was negative. Because she got it I think in her 20s. So that was back in 80 something. But and then also I had Hydea Broadbent, who is the one that taught me about U equals U.
Mm-hmm.
And may she rest in peace. But she came on the show, and she was phenomenal as well, because of course she contracted it from her mother as an infant
Mm-hmm.
in birth. And so but she talked about U equals U, and it's just so important that everyone do, because back in the day everyone thought it was because Magic Johnson had all this money, that's why he was walking around, and he was okay. No, it's because the research has gotten to a place where there are so many different medications on the market, and we can, there's something that can be done. But the key is you have to get into treatment. And if you don't, that's when you have, I had a friend that died, and I was like, but how? And they said he just refused to take the medication. Well,
Yep. And so we can treat HIV, and we actually don't have to get into places where we are living with advanced HIV or AIDS, as
Yep,
we
exactly.
So we can live and thrive with HIV and with the virus as long as we're on medication and care, and not have to see an AIDS diagnosis or see advanced HIV diagnosis. So I think that's key, and it's so important to really underscore having that conversation, getting the test, being in care. If the test comes back positive, we can be in care. If it's negative, talk about options for prevention and how do we stay negative.
So the last thing I'm going to say is, if you're watching this and you go to a church, I don't care if it's a Black church or not, but Black churches really particularly, because obviously our numbers are so bad, please talk to the people at your church about having a program where you can get this education. And there are all sorts of resources out there. You could start out with ahf.org and see if they can put you in touch with someone. You can send me a message. I will find you somebody, but get the information into the congregation, and let's, just keep spreading it and spreading it and spreading it like that, because we do know that the church is such a trustworthy place. But if the church members don't have the information, the correct information, then when somebody comes, they won't know what to do either. So this will help them, but it'll help you as well. And we need to inform all the generations. We said, the nursing home and assisted living, they have the same situations going on as some of these teens do. So we need to get all generations informed. So that's the entire church. So let's try and get those programs going. If you're at a college campus, let's get somebody to your college campus to come talk to your dormitory or something. Let's get these conversations going, because Black women, those numbers are awful. And we are like the most intelligent people. Aren't we the most intelligent ones in the country?
We are the most intelligent.
The most educated. So this is not looking good for us, guys. So let's do what we can to save ourselves, because, we can't count on anyone else. So we got to save ourselves. And we all know that the Black women are the head of the family. So we need to be the ones to help take care of and make sure everyone's okay. So therefore, let's make sure we're okay first so that we can do that.
Absolutely.
Thank you, ladies, so much for your time today. I so appreciate you and this wonderful information. And hopefully we can get these numbers down to nothing, because 57% is just wild.
Right. Wild. Hopefully next year, if we have this conversation, the numbers will be down.
Yes.
But we're going to challenge the viewers, right?
Yes. Let's challenge the viewers. Please share this broadcast.
And have back to say the numbers are down in Mecklenburg County, the numbers are down USA.
Yes.
And that the numbers are up for healthy, viable lives, and churches having open and effective conversation about human sexuality.
Definitely. Special thank you to the HVTN Faith Initiative and Black and AAHF. So appreciate you and all the work that you guys do, because you guys do a lot of work. I see billboards all the time. I see vans all the time. So thank you for continuously trying to get the word out and help us to get rid of this epidemic that started so many decades ago that we are still talking about, unfortunately. But thank you, everyone, and have a good night.
Bye. Good night.